hear me?
Can I hear who?
Lisa.
Hi, Lisa.
Hi, I just want to let you know I'm on the line, but I've got my email open.
Hi, everybody. My name is not Bruce Squires, and I'm not the president of the Children's Hospital. That's the good news. But I do have a note from Bruce Squires that says, "Hi, folks. Thank you for attending this town hall. I'm so sorry that I was not able to join you this week. The HHS Board of Directors meeting is at this time, and I wanted to be there to ensure that I could represent our teams, our patients, and families in our sites. In my view, this is particularly important as we take our first steps to gradually increase scheduled care while still ensuring, first and foremost, the health and safety of our people. The board has been extremely appreciative of the dedication, caring work of all of you over the past 2 months, and I expect I will hear that again. I will look forward to connecting again at our next town hall, but know you'll be well served by Lisa, Lori, and Barb, and Kelly today. Fingers crossed, with appreciation for everything that you do." So that's the deal for today. So I'm going to start by looking at the feedback we received about the town hall from last week, and which is good. 85% of people feel the town hall is a good use of time. Some of the comments, any idea of what our new workday will look like going forward? Great opportunities for change. What new processes will be kept and integrated into the old ways? And I would say that that's going to be the question of the day for a very, 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 very long time. And I think one of the reasons that some of the leaders are so busy, that it's exactly that kind of stuff that is being worked on in terms of what would the new world look like in terms of a marriage between virtual and non-virtual. What kinds of new processes would need to be developed for that? And when I know the other directors can hop in, but the amount of work and discussion that's going into that very thing is ongoing and will be, and ideas that you guys may have that this is an opportunity to advance practice from some perspective, because if we did this and that, then you should put that forward to your managers. And because people are, there's obviously no template. So people are trying to come up with the best practice. So your ideas are as good as anybody else's. Why it's not shared when Mumsy has COVID patients in the hospital? I'm a part of a team that travels to different departments, and it would help me to prepare by walking into an area where there's COVID. That's a good question. I don't have an answer for that. Do we have a policy around sharing, not sharing location? I'm looking for at you, Lisa.
Lori, it's Lisa. I'm not sure if everyone, all staff have the bed management tool icon on their Citrix apps. But if you do have access to that bed management tool on your Citrix apps, if you click it open and click under the Mumsy site, it will actually show you every unit on site at Mumsy, and it will also show you patients who are, not patients, but where patients are located that may be COVID positive or pending under investigation, meaning that the swabs have been done and results have not yet been reported. And that will show you if you have access to that tool. I'm not sure if everybody does though. So if you are in question and would like a snapshot of what that looks like for the site, please ask your leader of your unit, because I know all the managers have access to that tool, and it certainly is a snapshot in real time.
I also, just to add a little bit about that, I think, you know, in terms of privacy and confidentiality, we have to be careful in how information is shared about specific patients or their families. I think I would take a lot of comfort in the fact that there are the best precautions in place when there are COVID positive patients. The appropriate measures are already in place. You will not get COVID by walking through a unit or touching any services or surfaces in those units. So the precautions are in place. You will be safe. Everyone's following universal masking. So I don't I suggest you not panic, just inform yourself with the correct information.
Okay, thanks, Cal. And if people have comments that you don't necessarily you want to ask a question, put it in the chat box, and then I can address it that way. So we make best use of this time. I guess the bottom line is our behavior should be such that there is an assumption that there is COVID, so that we are that the knowledge is important. But I think that the assumption is a little bit like assume that there is somebody with COVID. We've been very lucky, but the precautions are there for a reason. The bulk of the comments really is around what the ramping up of service is going to look like. How are we going to ramp up ambulatory care and in a way that feels safe and maintain social distancing? What are the logistics around that? As you know, Colleen Fotheringham is leading that project. Well, you may or may not know, but Colleen Fotheringham is leading a project that is aimed exactly at that, the ramping up of virtual care. And it's a huge deal because of the numbers of clinics that we run. And it's a huge deal, obviously, because of the way our world is right now. All of those questions are being addressed in that. And as you probably have noticed that you'll see more people in coming in for surgery, and some of those clinics starting up. So it's a slow but steady process with a huge amount of efforts going into it. Lisa, did you have anything that you wanted to add to that?
No, all I'll add, Lori, that was really well said. To just reiterate, it is a ton of work that Colleen and her team is doing, and really to ensure that all areas are cleaned properly and more frequently as set out by the guidelines that were provided in the organization through infection control, and the social distancing and the moving around of furniture to create environments whereby we can maintain that social distancing. There will likely be maybe some changes or some innovation in relation to patient flow as patients and families enter the building, and what showing up to an ambulatory care or surgical appointment looks like. That there's more to come on that. It's really important that we also maintain and watch our overall site capacity as laid out by the provincial guidelines in terms of this phase 1 ramp up. And I will say that corporately, for those of you who may not know this, that there has been many, many meetings and planning in the background with various corporate working groups in terms of this planning, what it will look like. There's guidelines and details involved in terms of how things should run day to day and what that looks like in the clinics. And it's been something that there's been a lot of planning in the background. And so as we continue to plan for this ramp up activity, there was even an ethical framework that was developed corporately to determine what patients are most important to bring back in phase 1 that need the care they require. And that's really all I will say about that. I think it's going to be a really interesting time. I think that this phase 1 ramp up will teach us a lot about how to operate within the guidelines of COVID. And I think there'll be lots of learning, and I think there may be lots of course corrections and adjustments that we need to make along the way. And I think what's really important is we as leaders and as frontline staff serving our patients and families, we all really need to be open to this unknown world and what it will look and feel like. And just on the heels of that comment, just to really encourage everybody to maintain kindness to one another. I know that there's been a ton of change that has been thrown at everyone across the organization, and most importantly to all of you as frontline leaders and frontline staff. And it's just remarkable everything that has been accomplished. But as we enter this phase 1 ramp up, there will be probably changes that we haven't even anticipated. But we all need to remember just to be fluid and flexible as we have been, that we'll get through it together and really just support one another.
Thanks, Lisa. So, in looking at some of the questions that that's going to take me to a question regarding the ramping up and screening. What is the plan for relieving current screeners who are overwhelmed and overworked with very difficult schedules? The comment really says that, you know, the same staff have been doing this for a long time. When are they coming back? And time for a revamp. The other thing it says, and I'll speak to that, Josh can speak to that as well. There are some suggestions around how to do the screening. And one thing that is, just to Lisa's point, some of the challenges have been flagged, have been that people are not always very nice to the screeners. Now, it wouldn't be anybody on this computer screen, but apparently there are some folks who are impatient with the screening, impatient that they have to show their badges, and few every day who are inappropriate. Some are angry, have to show their ID every day. And you know, I don't know how to get this message out because strong enough. Like, it's a lousy situation to be in when you're already not in the situation that you signed up for. So how do you guys, how do you think we can address that better other than sending out the be nice messaging? And do we need to have some leadership at the screening stations who during peak times that could basically follow up on some of those behaviors? I'm not sure how big of a problem it is, but I just think that rudeness at the beginning of somebody's day shouldn't be tolerated. Maybe any thoughts on that? Josh, is this something that you hear about much?
I hear about it on a daily basis. The follow-up happens when I'm notified of it. So I do hunt down the individual staff members using the security cameras, and the individual managers are notified of particularly difficult situations that need to be managed. But the reminders to all staff from their leaders around this is a corporate process, everyone needs to show their badge, everyone needs to do staff screening, have been helpful in certain situations as well, but we are also following up on individual circumstances as they happen.
Thanks, Josh, because I think that's really important. And so looking at everybody, you can't fix what you don't know about. So yes, I think if you say to the screeners, if you take down the name, you don't have to get into the interaction, you don't have to get into anything. Just write down the person's name, contact Josh, and then let us deal with it. Because it's not yours to deal with, but I think I'm reassured that there is follow-up on that. Okay, so that's great. As for the question around what's happening next, as you know, most of the screeners came from a couple of areas, mostly out of Ron Joyce, because that building was shut down, and that left everybody in a position of saying being signed up for redeployment. So as the service on that side of the house starts ramping back up again under ministry order, it does not report to Ministry of Health, it's Ministry of Child and Community Social Services, who are directing us to ramp up virtual care. So what I can say, guys, who are on the screening in those programs, you are coming back, and it's not arbitrary and it's not random, it's planful. It's not as fast as you would hope it would be, but there is work on doing that. We are kind of hands tied a little bit from the perspective that we have to align with the priority codes of the hospital, plus align with what the ministry MCCSS is telling us to do. But we are trying to get you back and up and working as soon as possible. I think it's important that, again, if you have specific worries, well, I know that you do communicate them, and you need to make sure that they go up to your clinical leaders. And if there's something specific that we can follow up on, we will. I also know that work is being done around, conversations are happening about the long term. You know, if this is going to be lifestyle, and I keep saying this is not the new normal, this is lifestyle, so should plan as if it's lifestyle. I think you're quite right. We're going to have screening physicians are going to have to be physicians as opposed to staff being redeployed. And I would expect that conversation is going to continue. The suggestion that it could be students is a good one, except that in that students, it doesn't solve our long-term problem. So I think that be assured that the message around it's time to refresh our group of screeners for all kinds of reasons is being pushed forward. As for the schedule,
I just jump in a little bit there, Lori. I have heard confirmation that that plan is well underway, recognizing the dependency on the Raw and Joyce staff. We've been so grateful to all of you that have taken on this role and had to adapt to a new reality for this period of time that has been very difficult. And, you know, I have been down there too at 6 in the morning when some of the screening's been happening, and I really recognize the challenges you faced. But I do know there's a plan that's unfolding sort of as we speak. So stay tuned. You will hear about it relatively soon. I can't give you a timeline, but soon.
So the other thing is we also are hearing staff coming back who have been faced with challenges that are very traumatic. It's not just the environment, not just, but they're also being faced with upset patients, faced forward with grief, with loss, with people upset because they can't go into hospital with their loved one who has cancer, and that's a face forward of dealing with people who are coming because somebody's dying, and these are not people who signed up for that. That is a truly intense level of care. So this is happening a lot up in Juravinski as well. Some of the trauma at the general. And so the chaplains have been brought in to, can be called to deal with those particular patients. So hopefully having a resource for the screeners to say, I can't help you right now, but I can get somebody who can take the person into the hospital and do that. Josh, has that been working fairly well, or is it implemented?
It's been implemented, and the screeners are able to access the spiritual care practitioners throughout the large sites. And then we have smaller drop-ins at the smaller sites.
Okay, good. And then finally, the other thing that we're talking about is as people are coming off screening, because the schedule is so brutal in terms of how, and that's not as far as I can understand, that this is not something that people are doing to people, that is just a very difficult process that we have in place that was a difficult process before we got into this. And it has just amplified the problem in terms of what a schedule looks like. But we're also talking about how do we help people come back into their workplace, get a bit of re-onboarding into their regular work life, recognizing that they're tired, stressed, and sometimes traumatized. And so what would be helpful to staff to be able to be supported around that? So I just contacted Diana Tikas around that. And if any of you guys have ideas around tangibly what you think would be helpful, email me and I'll send them out. That doesn't solve all your problems around screening, but hopefully it addresses a little bit of the issue. If not, put up a chat or put it in your comments, and we'll go next week. I think it would be really nice if we could get a timeline out to people in terms of when these conversations are going to come to a decision point, so we can have that communication out. Some of the other comments have to do with the weather and the need for fresh air and the need to get out of the building. And so, Kelly, I'll let you speak to that a little bit. I know that we've talked about that. The little tiny courtyard off behind the cafe is open, which doesn't do a lot, but there has been discussion around how can we open the courtyard outside. And so I think it's important, given the nice weather And given the intensity of the screen, people need to be able to step back. So do you have anything to add about that, Kel?
I know that we're reviewing all spaces now and looking at opportunities to allow staff access to areas for eating, for respite, opportunity for fresh air. It is a matter of now looking at how we can expand those spaces safely while we still have limited access to the building. As you can imagine, we can't have all our doors open to anyone who wants to walk in, nor did we ever do that. But we need to just ensure we can maintain safe access to the building. So right now we're reviewing all the spaces. The courtyard behind the cafeteria, the cafe has been opened, and we'll continue to look at other areas that we can expand access to staff.
So I guess we hear that as a priority, and saying, like, with the nice weather, it's nice to get out for a walk. Is walking down the parking ramp to enter through the screeners section in the red section the only way to get back into the building? And that's not necessarily a safe thing to do. It's not bad when nobody's down there, but we're going to be getting more cars in. There isn't a sidewalk down the entire side of the ramp. Is it possible an open door in the purple or blue section would be nice? Could be open for a few hours midday. So we'll get back to you on that, but I think
Again, that's about maintaining access and how do we do so. And I know screening's being looked at differently for the future as well. So we'll continue to work with Derek and Alan and many others who may or may not be on this. There's 105 participants, by the way, so we can't see everyone. So we'll all work together so that we can open up more spaces for the staff in particular during the nice weather season and allow access back into the building.
Okay, thank you, Kelly. Somebody said that they've noticed some celebrations happening for staff that are transitioning to new roles, and that little bit uncomfortable that those celebrations are being done with food sharing and our potluck. So again, it's just a question that to be mindful as we get together. That it's just so easy for some of those social distancing rules to kind of be compromised. It's just so not second nature to us. But I think we have to be aware that when people get together collectively, even though it may feel safe in your social distancing, it really does make others uncomfortable. So that's part of that.
And Lori, it's Lisa Webster, just in support of all the patient safety work that we have done across the house at McMaster Children's Hospital. I would encourage people to feel empowered to speak up. If you're seeing these things happen, don't be afraid to be that voice, to voice your concern in concern of other people's safety. I think that there should be no harm, and we should embrace feedback and maybe, and I'll just give people an example. We were actually in the administrative offices without masks on, sitting not 6 feet apart. And in all fairness, Bruce walked right in the office and he reminded us that we were not practicing good social distancing. And so, we course corrected, because people do forget and people do get more comfortable as we do not see the COVID spikes that we anticipated. We're understanding people are letting down their guard. I think we've all maybe been cognizant of our own behavior that way. So please do speak up and help each other.
That's great. Yeah, too. And if you're shy about it, speak to your manager or send one of us an email, and we can remind people. I am wondering about COVID swab testing for staff RNs. Please address and seriously consider more testing for COVID-19. Okay, I'm looking at the screen, hoping somebody will say, okay, we've got a plan for that. but I'm not sure that we do. Does anybody can? Do
So
we,
I'll start us off, and it is still an area of some slight under consideration. And we do have a group that looks at recommendations and decisions around, what are some next steps. And this screening for COVID, asymptomatic screening, is still an area where even the province is looking at, how do we increase the numbers of testing? So I don't have an answer. And I'm not sure if there would be targeted testing for one specific group, but I know that this is under consideration across HHS. So please stay tuned. I know it's been an ambivalent time, or ambiguous time, I guess, but please stay tuned. I know that this is being looked at. And is it getting time?
so I was wondering where the bucket went.
Yeah.
Does anybody have anything they want to say before we make the draw? But is there any, even through the chat, any question you'd like addressed? Use your time.
Okay, so I haven't done this before. I don't think it's all that hard, but I get to draw 3 names from this magic bucket, and they're for an M&M gift card. So, and now I have to not see, and you're just gonna all have to trust me. There's been some randomization and the buckets twirled. So, Naomi Forsey Mumsy. Michelle, am I supposed to read out the comment? I don't think so. I think we covered this off. So we did cover this comment out. So we'll let her know, and there was no bias there, but she's in my portfolio. Okay, number 2 is, forgive me, Steve Turgeon. He's one of the screeners. So that's the second person. And the last but not least is Lee DeMeester from Biomed.
Thanks, Kelly. Before I go, we need to do our celebrations.
Yep.
And the focus and continuing commitment to safety and error prevention. The month of April, we have many zeros to celebrate. 0 catheter-associated urinary tract infections. 0 pressure injuries. 0 falls. 0 adverse drug events. 0 MRSA. 0 non-MBICL central line associated bloodstream infections. So 0 is good.
Lisa, 0 is amazing, and I know we've had lower volumes, but regardless of the volumes that we've had, these numbers and the data that this provides and the performance in terms of safety at Children's Hospital is outstanding. And that is all because of all of you at the front line doing the work you do. And kudos to you guys, the quality nurses, the frontline leaders, all in an effort to really follow the bundles and follow the work that is set out that we're a part of with SPS, Solutions for Patient Safety. And it's just the results have been remarkable. And thanks to Barb and the data team.
Okay, thanks everybody. Bruce really does hate to miss this. Like, he truly is so committed to hearing your voices. It's hard with so many people to be able to speak up, but we do want to hear what you have to say. So do the survey and send in your questions. And if we don't answer, send them back. And if we don't answer, ask again. Have a good.
Thank you, Lori. Thank you, Kelly. Thanks,
Bye.
everybody.